awesome. Moving to my first real question, the complexity of this crisis demanded creative, rapid problem solving and implementation. How did you and other leaders in your organization foster an environment that encouraged this? There was no way this could just be top down. There had to be so much innovation. And to sneak in a second question, what other reflections do you have on leadership in the healthcare space born from this crisis, from what you observed and what you experienced and did? Nick, I think we'll start with you on this one and then go to Linda and Anne.
Sure. So I think the most important thing that our organization did was we assembled an emergency medicine, and I'm thinking of this just from kind of the clinical emergency department operations perspective. Our enterprise, New York Presbyterian, organized an emergency medicine working group that was led by our two academic chairs, Dr. Angela Mills at Columbia, Dr. Rahul Sharma at Cornell, and really anchored by one of our senior vice presidents, Dr. Kate Halpern, who's an emergency physician and now runs Weill Cornell Medical Center. And they got us together at peak. We were meeting every night. It was all of our teams, our nursing leaders, our physician leadership. And I think that really allowed for sharing of ideas and innovation, and also bringing things to light that senior leadership needed to know in next to real time. And this was the first time that our organization was operating in that way and in such an efficient way. And I can think of a few things that really needed high-level senior advocacy that was at the CEO level, the greater New York level. Sort of early on, we were identifying that there was a challenge in the city with treating homeless patients who may or may not have been infected with COVID. And we were identifying this on the front line. And for that to go from, a clinical case in the emergency department to the SVP of our organization that evening, to a group meeting with our government affairs folks the next day, to really get an answer from City Hall and the state in terms of what we were doing with a particular issue, was incredibly helpful and empowering. I think for the front line to feel like the whole organization is responding to what you're seeing on the ground, I think that was incredibly empowering. Similarly with clinical issues, so we were also identifying there was an enormous need to help with end-of-life care. And there were many patients coming in from nursing homes with unclear goals of care. When we were clarifying goals of care, there wasn't necessarily the desire to be on a ventilator. And that was something we identified and were able to put in systems across all of our hospitals to address a clinical problem. We actually recruited palliative care physicians from all across the country to help do consultations within our health system. We really had to tackle this problem from all angles to avoid kind of the disaster scenario that all of us were thinking about. In terms of leadership lessons, there are probably tens of thousands that I can think of, but the biggest, I think, in reflecting on this experience were one, as a clinical leader, to always project calm, but also to be human. There were, and show the human side of what was going on. There were days that were just beyond, that were not imaginable. And I think as leaders, we needed to really empathize with how people were feeling. This was impacting everyone's whole life. It wasn't just sort of a workplace thing. This was all encompassing. And I think it was really important to show emotion and to show compassion throughout the crisis. Second would be proactive communication. And transparency in a related way. I remember it was really early on, like maybe the second week of March, and we were starting to get enterprise-wide analytic reports on how many ventilators we had, how many ICU beds we had, et cetera. And we had that on the leadership level, and the team on the ground, there was just one of these, massive reply all email chains where, someone's panic was it was just accelerating and snowballing. And it was very clear that if the team on the ground just had the information that the leadership team had, it would circumvent all of it and allay a lot of fears. So that's a lesson that I continue to learn over and over and over. Third, even leaders need breaks. All of us were running like crazy, and I have a partner at work who I get to work with on a lot of things, and she and I would take days off, and I would cover for her. We would debrief at the end of the night before going in the next day, and we would hand off to each other, and also model that for the people that work for us, so they would see it's okay and it's necessary to take a day off. And even, when it started to space out a full weekend, this was not, this was different from a lot of the other events that we prepare for, in that it was, it's still going on, right? We're still ever ready. So it was just so protracted. So leaders need to take breaks. And finally, I would say, you really need to designate leaders and delegate responsibility. And it was really an opportunity to bring up junior leaders. So we had some, few examples of physicians who were certainly operating outside of their usual silo, but also junior leaders who had sort of raised their hand before and now were given huge substantive responsibility, and are now, their leadership trajectory is just accelerated, which is really exciting, and it's empowering for those folks as well. So those were my lessons.
Nick, thank you. Reflecting on all of your answers, a couple of themes strike me. One is that you all talked about structures, either using structures that existed and expanding those structures, or having the foresight to create a new structure where one didn't exist. And then the importance of recognizing talent and expertise, and then really allowing folks to spread their wings, whether it's because they raised their hand or because they had a unique insight into something like telehealth that needed to be expanded. And then obviously communication. I mean, this is across all emergencies, but in this one in particular, and because this event was so long and continues to be so long, it does give us the opportunity to have these rapid innovation and iteration cycles. And all of you talked about how you tried something one day, it didn't quite work, you were able to rapidly fix it. And I think that's really incredible. And you talked about resilience and leadership, and I want to stay on that topic for just a second. The dedication and selflessness of New York's healthcare staff during the spring surge was truly awe-inspiring, and not just the frontline providers, but all the individuals who kept the health system running. And in the aftermath of the COVID surge, there's been a lot of discussion about and concern about the workforce's well-being and their resilience. I'm wondering if you could reflect, what did you learn about how to support staff during the emergency in the weeks and months since the surge? Of course, now we're looking at a potential fall surge. And how has this experience altered your approaches to supporting staff in the future? And Linda, we're going to start with you this time, and then we'll go to Anne and to Nick. So supporting staff.
The one thing was very clear from the beginning with our leadership, and that was to make sure that our staff was safe and that we had strategies in place to support them. Over 1,400 Memorial Sloan Kettering staff members came down with COVID. We were very concerned, obviously, about our staff and about their perceptions with regard to our support and their safety. We did a number of different things, and we're very transparent with communication as well about them. We did things like make sure we had external cleaning crews and other folks come in organizationally to support our staff and to support our staff that was doing that work. We were very clear on PPE conservation and extended use protocols. We communicated huddles, reached out to staff at each of the floors. In the beginning, it was very tough. PPE was a very big issue for everyone organizationally, but it was so important, obviously, for the safety of our staff that we made sure that we were very transparent with it and that we did everything in our power to obtain PPE, as every other hospital did, to the point where even we had a PPE at mskcc.org email to try, to go with every lead, whether staff came to us or donors came to us. We did things like that as well. We developed a COVID resource desk in the emergency command center, and that was geared toward making sure that not only did calls come in requesting from staff or concerns, we were able to call those calls, send them to the different areas, whether it be human resources or employee health. We had to have one-stop shopping for our staff so that there was not confusion. We also made sure that staff knew that we were concerned about their contact with patients and how we would protect them in additional ways. So we had 3 levels of patient screening prior to them being, prior to patients being seen by a provider the day before with a phone and text upon arrival and upon check-in. We immediately established cohort areas for patients, for those patients both in the critical care areas, designing new critical care areas as well, and cohorting on different floors. So resilience to us was extremely important, and the perception and not the perception, because sometimes perception is reality, right? People hear things, disseminating information, and then having conflicting information was a concern. There was information all over the internet, all over different hospital providers were on different listservs and things and sharing information. And we had to make sure that our communication was very clear, very accurate, very transparent, and that was a main focus, and our team here did an excellent job with that. So to us, the number 1 priority was resilience of employee and the safety of our employees. So we made sure that we had vacation pay, payouts, travel expenditures that were reimbursed, hotels, programs for psych support, food and vacation, and other things that they needed to make sure that our staff remained resilient and that they had the rest that they needed, and that they had no concerns that the hospital was not being transparent.
And we, of course, got the hindsight question, right? We have a sophisticated audience here, that what would you have done differently question. And a lot of you all commented, I wish we did the right thing. We just should have done it 2 weeks earlier or a week earlier or a month earlier. So setting aside doing things earlier, what are 1 or 2 things that you would have done differently, whether it was clinically, operationally, communication, anything? Who wants to start?
I'll answer quickly from an emergency management perspective. Clearly, although we had some good stockpiles in place for PPE, obviously left over from Ebola, I think that personally, as an emergency manager, I wish that I would have had even more stockpiles in place. Space is a premium in New York City. It's even hard to get mini storage space. But to me, that was one of the most important things, I think, was the fact that our staff was very concerned, especially in light of the shortages of PPE and how the supply chain impacted us from China. So that being said, personally, my personal opinion is to beef up PPE and the protective measures that our staff needs to make them feel safe and to keep them safe.
Thanks, Linda. Anne, do you want to share next?
Sure. I mean, even if I look even back pre-COVID, I would say there are a number of things, initiatives that I think we had kind of been spinning our wheels on for a little bit, and And I think if they had been in place rather than this event forcing us to put them in place, we would have been in a better position. I do feel on the positive side, though, that those systems and tools are now there for us. So I do think we're much better prepared, and that creates a lot of better sense of security for our patients and staff. I think also, I don't know if this was avoidable or not. I think the information was changing so much that my one thing I would say was, while we were excessively communicating, I think that because we were communicating so much and there was so much change, it did often lead to confusion, right? It's hard I think there was so much pressure on our managers and leaders, and to expect them to be able to trickle down all of these changes pretty much hourly, daily, was relatively unrealistic. And so I think, we probably going forward need to try to better find that balance of being transparent, but also making sure that we're not overwhelming people with information that it's too difficult to adapt.
Thank you. Nick, you're going to get to the last word here. Well, I'm going to end it there. I really, really want to thank Linda and Nick for just being so frank and so insightful about your experiences and the lessons that you learned. I learned a tremendous amount from you and really enjoyed the conversation, and I'm sure all of our attendees did as well.